and welcome to another update on the COVID-19 pandemic that we see across the world. I'm Dr. Schalk from Dr. Luke on Call, and today we really need to pay attention to a very important topic. We're discussing two things, and I'm speaking to specialist physician Dr. Rust Theron on our older people that are most at risk. And secondly, we're also going to talk about ICU and a little bit on ventilation and what are your risks and the actual chances of being discharged or being extubated from a ventilator when you're in ICU. So without any further ado, welcome to Dr. Rust Theron, a good friend of mine that I've known for many, many years, and thank you for discussing with us today, and thank you for your time today. Welcome.
Thank you, Schalk. It's a privilege to be here and to share some information and experience. If we look at a COVID pandemic and the cause of the disease, one must realize that 81% of people will have only light symptoms or hardly any symptoms. Only 19% will go to the phase 2 of the disease where they have more respiratory symptoms, difficulty in breathing, and they need to have more specialized medical care. And of that percentage, 5% will require intensive care. And that's the patients where the immune system goes to war against the virus. And it's the inflammatory response that actually makes them so sick.
Thank you. That's good information. So what you're saying is that a very small percent, let's say we've got 100 people, 5% of those people might end in the ICU because the immune system is overactive and it's causing complications in the lungs especially.
It's an uncontrolled immune response. We call it the cytokine storm, and it involves mostly the lungs, but also other organs. So we see liver, heart, and kidney involvement or failure in those kind of patients. What one must realize is that a lot of the progression from phase 1 to phase 3 is age dependent and depending on the patient's abilities, meaning if the patient's got any other diseases. So our younger patients, our children, are most likely to fall in the 81%. Some of them will hardly have any symptoms. The older you, the bigger the chance is that you will develop phase 2 or phase 3 of the disease. And that's why it's so important that we must consider children as vectors, because we can't test everyone because they're asymptomatic, they're not going to qualify for a test. But we must consider them as a carrier of the disease, and they can expose the elderly or the most vulnerable, and that we need to protect them from being exposed.
Okay, so yeah, because that's going to be the question now. You know, when lockdown regulations are eased down, how do we protect grandma and grandpa? Because now the children might be going to school again and they're going to have contact and we don't want them to get sick.
Grandma and grandpa is also the people who are not only most vulnerable, but are also more dependent on social interaction, help with cleaning the house, help to doing the garden. And we all think that after lockdown, it will be easy, we can get them to help to go in the system. But then we're actually putting them at risk. And the important thing is, if we really love and care for them, we must limit social contact as much as possible with them, direct physical contact. We must rather engage on the social media platforms like Zoom or telephone or WhatsApp call and try and avoid physical contact. The virus is spread by people. So if we can limit contact with people, we will limit the spread of the virus.
Yeah, that's very, very valuable. And obviously our winter time is coming up, which is often flu season as well. The goal there is for them to not get the virus at all, and for immunity to develop amongst the younger and the more healthy population.
That would be ultimately the goal, to protect the vulnerable as long as possible till we have a bit of a herd community. And that might take time, and it's very painful and stressful for the elderly because they're the people who want to reach out or people that you want to reach out to.
If we then do get the unfortunate situation that our elderly do get ill, let's say grandma or grandpa get ill and they start getting shortness of breath, their chances of actually having to be admitted and maybe even ending up in the ICU is obviously elevated.
Schalk, we try and limit admissions to hospital as far as possible. So if a patient with COVID positive can be managed at home. We would like to try and manage as many of them as at home as possible. So if your heart rate is below 120, your breathing rate is below 25, and your saturation is above 90 when we access you at hospital, we would try self-isolation, home care, with the proviso that you be able to have self-isolation and that there will be somebody to help you at home. If not, we need to admit you, and we'll keep you in a COVID ward separate from other patients, and do all the protective things we can to protect ourselves, other patients, and the medical staff. If we look at data in China, in the first 3 months, 7% of all deaths took place in healthcare workers. And it was due to the healthcare workers not wearing proper PPE, so not good protective measurements were in place. Since March, where they were having good PPE, there was no death in healthcare workers. And we must draw that line of protection through to the elderly, because they are the most vulnerable. If they get a disease, they are the highest risk to develop complications. If we have the patient admitted in the ICU, there's certain specific things that we do, and the most important is to help them to oxygenate properly. So we will give them first nasal cannula oxygen, and that's not sufficient. One will go up to 40% oxygen by mask. We can increase with the poly mask to about 60 to 80%. And if that doesn't work and the patient develops multi-organ failure, we need to assist them by taking over the work of breathing and giving them up to 100% oxygen with a ventilator. We know that morbidity and mortality goes up through the different phases, and if you in the phase 3, then mortality differs from studies to studies from 20% up to even 80%. We were, in our case now, successful to get a 68-year-old patient off the ventilator. He had some comorbidities, and he's going to recover fully. But we had a privilege at this period of time that our COVID burden in the hospital is not very high, so we have the tools available to give him special care. This might change if the numbers change. Therefore, my urge is to try and rather prevent patients from progressing to the ICU, is to prevent and protect the vulnerable so that they don't get the disease.
Yeah, that's very insightful, Rust. I think the other thing that I also want to just make clear for the viewers that if you say, if the oxygen levels deteriorate and you have to help them with breathing and they go onto a ventilator, those patients, as far as I understand, get sedated. So they almost get put into a semi-sleep that they cannot fight the machine. So they're actually almost like they're in a coma. Is that correct?
That's correct, Schalk, because your biggest problem with ventilation in the COVID patient that differs from your non-COVID patient is the pressure in the lung. The minute you have to use a higher pressure to ventilate, it seems that you cause more damage to the lung. Obviously, if you're awake, you can resist the ventilation, and that will increase the pressure that you need to use to ventilate the patient, which will increase the risk of lung damage. And that's why we sedate the patient. We know that it's unfortunately for patients and family very difficult if we take a patient to ICU now. Because of the limitations on visitors, we try and keep visitors away from hospital to keep the feet in the hospital low, lower the risk of spreading the disease. And I can imagine, and I've experienced with the patient, that if you separate from your loved ones and you are critically ill, that it must be very stressful and difficult. We try and communicate as much as possible with the families. We try and set up Zooms, WhatsApp calls, so that the patient can communicate or that they can see what's happening with the patient. And we try and give information on a daily basis of the progress of the patient.
That is very valuable. So, if I listen to you carefully, it's almost like it seems to be the case that everyone had time to prepare properly to deal with it, and we are not overburdening our healthcare system so that you can look after a patient properly. And the longer we can do that, the better.
The longer we can do it, the better. It also gives us time to set systems in place, get protocols in place.
Mm.
One thing that has come out of this COVID pandemic is that all the doctors are communicating 10 times more with each other.
Mm.
So you will find that it will be very rare for one doctor to treat a COVID patient by himself. We've got a much more bigger team approach. We use the anesthetists more frequently now. We are on platforms with our colleagues in different hospitals, different countries, and information gets disseminated on a daily basis. And what was the golden standard of treatment 2 days ago has already changed in 48 hours time.
I think we can with confidence say that our leadership, it's come really from the top. The fact that we have teamwork down on ground level in the trenches is because our president has taken this up from the beginning and said, this is how we're going to deal with it. And we're not going to do it the same way certain European countries were doing it. And we're going to learn from it and do it better. So there's a lot of hope. It looks like we're on the right track.
As a doctor, as a medical healthcare worker, I salute the president. We're looking at saving lives and looking at patients' life. For him, it must be extremely difficult to balance the saving of life versus the effect that it has on the economy. But I always feel that we can revive the economy, but a life lost is a life gone.
Dr. Theron, thank you very much for your time in a very busy schedule, and it's weekend for giving us time to do this. I think it just shows that the message is we will overcome this. Act sensibly, be disciplined. If we work together as a community, we will overcome this.
I agree, and we must stay praying that God's grace will protect us.
Yeah, absolutely, and we're focused, and that's exactly where our strength comes from. So thank you for your time again, and it's been a privilege to talk to you.
Thank you, Schalk.
That was Dr. Rust Theron, physician specialist that I spoke to with some real good insights. And as you can see, there's definite hope. So important in this time where the lockdown is getting lowered a little bit because of the levels. Stay focused, do the right thing, do not have unnecessary contact, especially with the elderly. When we go back to work, when we go back to school, avoid unnecessary risk of spreading the disease. Thank you for watching. Stay home, stay safe, and stay healthy.